Thank you for choosing UCS Healthcare. We will assist you in identifying and building upon your individual strengths and help you in choosing services that you find useful in promoting your long-term health and recovery efforts. Our treatment plans are patient-centered, and we invite you to be involved in the design of your plan. We are here to help you, and the success of treatment depends on you and your investment. Recovery from any health diagnosis such as substance use disorder, mental health issues, or disease is a long-term commitment and requires long-term support. We are happy to work with every individual regardless of their abilities or challenges. Please notify our staff if you desire special accommodations. In this video, we will cover the following topics: what we do here at UCS Healthcare, your role in treatment, and how your treatment plan is developed and implemented. Before we get started, let's talk about expectations and guidelines. This orientation covers the basics, but is not intended to be all-inclusive, as policies may change and may not provide a detailed explanation of all policies and procedures. If questions remain after this presentation, please consult the handbook you were given, treatment staff, or another member of the team, or visit our website at ucsonline.org. Okay, let's get started with some basic guidelines. Starting with, when is treatment available? How will I know if UCS Healthcare is open or closed during bad weather? First, we are closed on Sundays and major holidays. Holiday hours are posted well in advance. If a closure is necessary due to weather and/or crisis, we will post that information on our website and our social media channels. Always call in advance if you're unsure about our hours or weather situations. If you are experiencing an emergency, call 911 or go to the nearest emergency department. UCS Healthcare has an answering service for crisis issues after office hours. This can be reached by calling 515-280-3860. What are the behavior expectations of the UCS Healthcare program? Put most simply, show respect and be polite. We expect courteous and considerate treatment of our patients and staff at all times. Treat others with respect and dignity, just as staff and peers within the clinic will treat you. We are committed to an atmosphere that is positive and affirming, free of tension, harassment, or inappropriate comments and behaviors. Attendance. Repeated unexcused absences will be addressed accordingly in order to ensure that you are getting what you need out of your treatment experience. Zero tolerance policy for violence. Any threats towards you or others will be taken seriously and addressed immediately. You will be asked to leave the office immediately. The police may be called for support. Unruly, obnoxious, boisterous, vulgar, or other disruptive behavior, whether chemically induced or not, is prohibited. You will be asked to stop this behavior or leave the premises. The police may be called for support. These rules that are in place for the safety of our patients and our UCS Healthcare staff. We serve adults, adolescents, and children. It is your responsibility to report if you are a registered sex offender and follow any and all restrictions in place. If you have been convicted of a sexual offense, this does not exclude you from receiving services. Use of illicit drugs and licit drugs used illegally are prohibited on our property. Weapons are not allowed on property. This includes firearms, pellet guns, or other weapons including sprays, stun guns, knives, etc. In addition, please note the following. If you have a medical emergency or threaten to harm yourself, your treatment staff member will call your emergency contact and/or emergency personnel. No tobacco use, including chewing tobacco, shisha, nicotine gum, vaping, and green cigarettes within facility or on grounds. In order to maintain cleanliness in the common areas and group rooms, food and drink are not allowed. You may bring a water bottle with a cap. Notify staff if you have a concern regarding a spill, damage, or other potential safety risk in these areas. Cars left overnight at any UCS Healthcare location will be towed at owner's expense. If you are having car trouble and the car must be left overnight, please let the front desk know or the car will be towed. Now that we've established the guidelines and expectations, let's move on to treatment. During the intake process, you were provided with a handbook and signed several documents. To review, here is what you signed during the intake process. Acknowledge that you received the handbook. Consent to participate in treatment. Releases of information. If you would like a copy of your consent to participate in treatment or releases of information, please ask your counselor. Now that you are enrolled, how will treatment work? You completed an assessment. A counselor has been assigned to you. You and your counselor will develop an individualized plan, will discuss and agree on type and frequency of services. Long and short-term goals will be established. The treatment plan will be updated and reviewed with you on a regular basis. As your goals and objectives are accomplished, you will begin discharge planning with your counselor. We encourage family and significant others' involvement. UCS Healthcare wants our patients to know one thing. You will not be denied treatment for financial reasons. We will work with you to find a feasible solution. Different services at UCS Healthcare have different fee structures. You likely had a discussion of your fee structure and funding upon admission into any services. You may be asked to provide proof of income, a recent pay stub, last year's tax form, etc., and proof of number of dependents before and at random times during your treatment. If you are uninsured, please talk to the front desk or your counselor on how to sign up for Medicaid. If you meet eligibility criteria for your treatment to be subsidized by the state or federal government, and the calculation is higher than 10%, you can request a financial hardship. Please ask your treatment staff member for the financial hardship form. You are expected to pay for services. Remember that any paperwork you may need from UCS Healthcare will not be provided until appropriate financial arrangements have been made. What if I don't meet behavior expectations? We will work with you to make changes in your treatment plan and avoid dismissal from the program if problems arise. You may be dismissed from the program if it has been determined that your conduct is adversely affecting others and remains unchanged. Issues leading to discharge from programming may include, but are not limited to, attending group or individual sessions under the influence of drugs or alcohol, continual disregard of your treatment plan and goals, not keeping appointments as agreed upon in your treatment plan, continued illegal use of substances. This criterion alone is not sufficient for dismissal. Repeated failure to take medication as directed. Selling or purchasing drugs on UCS Healthcare property. Conduct which adversely affects you, other patients, or UCS Healthcare staff. If you are dismissed from the program, UCS Healthcare will work with you to make an appropriate referral to another program within the area. What are my rights? Your rights are very important to us at UCS Healthcare, and we want to make sure you understand what you can expect. These rights are posted throughout our facilities. We will also review these with you when you start treatment and at a minimum on a yearly basis if you are still receiving services at that time. You can also review the patient rights statement on our website at any time. At UCS Healthcare, we take confidentiality very seriously. For the protection of confidentiality, you are not allowed in any private office or administrative area unless a staff member is present. You are expected to adhere to confidentiality and understand that what you see or hear within the facility stays in the facility. There are legal penalties for breaking confidentiality rules. Generally, no information is released without your consent. The exceptions are: you sign a written release of information. A court order or other mandated report allows the disclosure. There is a concern of child abuse or dependent adult abuse. There is a crime or threat of a crime committed at the program or against a staff member. The disclosure is made to medical personnel in a medical emergency. The disclosure is made to qualified personnel for research, audit, or program evaluation. Most importantly, what you see in group therapy sessions or in the clinic, what you hear in group, stays in the group. If you feel that your patient rights have been violated, we have a grievance and appeals process. Grievance is defined as a perceived violation of a patient's rights. You have the right to file a grievance relating to your perceived violation of patient rights. The first step is to talk to your treatment staff member. Second step, if you continue to be dissatisfied, the next step is to submit the grievance in writing to the clinical director. The grievance form is on the website www.ucsonline.org, or you may obtain the grievance form in the lobby of the main office suite. Any staff member can assist you in completing the form. You will receive a written response within 10 working days of receipt of the grievance. If you are dismissed from the program for misconduct, you may appeal this decision through the grievance procedure. Your grievance will not result in any retaliation or barriers to services. This appeal and results will be recorded in your file. You don't have a grievance, but you have a complaint, a comment, or, this would be great, a compliment. We want to hear about it. Each location has suggestion and complaint box that you may use for suggestions or complaints. You may also go on the website www.ucsonline.org to submit complaints or suggestions. If you would like a response to your suggestion or complaint, please put your name on the form. What is the difference between a complaint and a grievance? A complaint is usually environmental, that we do not allow coffee or food to be brought into the clinic, or hours of operation, or that you don't like what's on the monitors in the waiting room. A grievance is when your patient rights have been violated. This has more to do with your treatment or the staff providing services to you. If you have questions, be sure to ask UCS Healthcare team members. So you've completed services. What happens now? Once you've completed services for substance use disorder, please know we still care about your recovery. UCS Healthcare, in conjunction with the Iowa Consortium for Substance Abuse Research and Evaluation, may complete follow-up calls and/or written correspondence to ensure your well-being. On a periodic basis, you will be asked to provide patient feedback through an online survey or through our website, www.ucsonline.org/patient-feedback. Please take the time to fill out this survey. All information is reviewed and utilized in making changes to services to better meet your needs. Personal information obtained from follow-up surveys is confidential and will not be shared with other personnel or entities. What if there is a crisis? If you are in an intoxicated state while at UCS Healthcare, you will not be allowed to leave the building. Staff will assist you in notifying a friend or family member or appropriate authorities to escort you home if you are unable to get there safely on your own. When you're at UCS Healthcare, your safety is important. Please be aware of these safety measures. Emergency exit signs and fire extinguishers are located through the building. You will be instructed and assisted in leaving the building. Do not risk extinguishing a fire that is out of control. If an emergency arises due to an explosion, you will immediately vacate the premises. You will be instructed to go to a designated meeting spot to seek safety from fire or explosion. Controlling bomb threats. If a suspicious-looking material is found on the premises, notify staff and evacuate the building immediately. Any threat or perceived threat will be taken seriously and treated as so. If you feel threatened by anyone, please notify staff immediately. Tornado, flood watches, warnings, and dangerous weather conditions. Staff will continuously monitor changing weather conditions. If a weather warning is in effect, you will take immediate shelter in the designated facility areas. Again, thank you for choosing UCS Healthcare. We know you have choices about your healthcare, and we are honored to partner with you in your total health. If you have questions, please visit our website at ucsonline.org or speak to any UCS Healthcare staff member.